Hello and welcome to our sixth installment of the regional report outs for the Southwest region of Kansas. Today's January 19th, and we're glad to have you with us. We're here every week at 4 o'clock, ready to update you on kind of the healthcare status related to COVID for your region. And I want to encourage everybody, please go to the website, covid.ks.gov/report-outs. And I will pull that up here. Megan, if you can make me the host so you can see what that looks like. But if you put in your email address, you can get this sent to you and the dashboard and any other pertinent information. Great way to stay in touch. And so this is what that looks like. Really easy. covid.ks.gov/report-outs. Put in your email address. And you click on Southwest region and subscribe, and you'll get it. And then you can look back on archives also for these calls or the dashboards that go with them on this page. And so here we are in the Southwest, and what we'll do is stick with our regular protocol here, where we start with the dashboard that our friends at the Kansas Hospital Association put together for us so generously. And then I'll kick it over to public health to get an update over to the hospital hospital representatives, get a little boots on the ground. And then today we have our friend Dr. Watson from Cheyenne Mountain Software to talk about the transfer situation. And we have a guest from KDHE to talk about how the state is working on its testing protocols also to make it more accessible and a better fit. So good news really largely across the state. We're seeing good trends go on. So you can see we've been watching the staffing shortages. We've told you hospitals, when they run into pitch points, it's staff, it's stuff, or it's space. Staff has been the issue the last couple months. Only 1 of the 18 hospitals anticipating staffing shortages this week. It's a good trend, as the staff is getting vaccinated and that's rolling through. We're seeing some good things happen there. And then comparing these numbers. So when we're looking at the census count of COVID patients in the hospital, really good improvement here. We had 55 COVID or suspected COVID patients in the hospitals in this region last week, down now to 39 this week. We do have a couple more COVID patients in the ICU. We went from 9 to 11. And less beds available. We had 9 last week, down to 4 adult staffed ICU beds, taking us to 18%. But really good news down here, where you see we had this peak that's really put a lot of pressure on the system here in late November and December. But as people took mitigation efforts and things worked out, you can see the weekly case count has come down and begun to settle out a little bit about where it was before that spike, and even a little below here with 358, our lowest number since the middle of October. So it may be longer. I'm not seeing further back, but that's just a really good sign with what we're seeing. And also, I know you don't see the rest of the state on this dashboard, but as people have to be transferred out into the hospitals with more acute care capabilities, they're finding more space in their ICUs also. So, pretty good news here for Southwest Kansas. So you can see the percent of the population in each of these areas that has tested positive for COVID, and then the census on the ICU beds in the region, COVID, non-COVID, and available. And again, these numbers are pretty dynamic, hour to hour in the hospitals and day to day. But we do catch a moment in time, and appreciate the Hospital Association putting this together for us. One other thing while I have the screen, we talked about this last week, but this website the state has put together, kansasvaccine.gov, kansasvaccine.gov. If you go to vaccine data up here on the top right corner of your screen, puts a little dashboard together, and this will be an interesting dashboard in the weeks to come. We still have a data lag issue around the number of people vaccinated. I know that's north of 125,000 people at this point. But you can see how many doses are headed to the state or have gotten to the state. And then first and second administration of those doses. And then 3.5% of the population has gotten dosed, which is great. And then you can see, if you're curious, Pfizer versus Moderna. And then, day to day, how many people are getting their first dose, how many people are getting their second dose. So you can see as we're moving through and getting closer to the end of phase one. But you can see as the vaccine rolls into the state, they get it out into arms, have to wait for the next shipment to come. They get it out into arms. And so, that is the kind of the rhythm and the peak that we'll see. And as we hope to start moving into phase two in the next week or so, this would be a real interesting thing to watch. So just go to Kansas Vaccine. Remember, vaccine has 2 C's as you're spelling that .gov and find your way there. So that's the dashboard and a little update. Let me kick it over to Jeanette to give us an update from the public health perspective. Jeanette.
Thank you, John. For public health, we're still seeing some cases, like you've shown on the dashboard, that our case counts are decreasing. We are getting vaccine in. We're still trying to prioritize those that are specified in phase one, but we are gearing up to make lists and prioritize who should get the vaccine for phase two. We got notification today that we are not only getting doses for our second doses that we, gave out 2 weeks ago, but we are getting more. So vaccine is coming from the state, which is good. We do have some people that are still concerned, that it's too early. It's not known exactly the full effects of the vaccine. So we're trying to work through, debunking those myths and those concerns. The other thing is that with the vaccines that we've given, we've had some people have some reactions to it, which, when they report those, we do tell them that, most of them are having the known side effects that were listed by Moderna and Pfizer. But we are, referring them on to the VSafe website so that they can report that out. And then we're also doing the VAERS reports to CDC. So most of our work these days are focused on, planning for the vaccine and making lists and getting it out to the public as soon as possible. So.
Yeah. You make a great point there, Jeanette, and too, just so people know. So whenever the state decides, which we again anticipate next week or so, to move from phase one to phase two, the population set in phase two is much larger than the population set in phase one. And so it'd take longer to move through that group. And it can move only as fast as the speed of supply that we have from the federal government allocation and that. And what will happen as far as the prioritization and the rollout of phase two, that is up to your county health department. And so your local county health department will be communicating with you how to sign up or where to go and all that. So you'll want to be paying close attention to them and the work they're doing to prepare for the vaccine. And they're still waiting on a little more information from the state. But I think when they have that, they'll begin communicating with you about how you can get it in your county and what that looks like. Would that all be right?
That would be correct.
Okay. So pay attention to these great people like Jeanette here to just keep it rolling for us. Now let me pass it over to Mary. Jeanette, anything else you wanted to throw out there?
That would be all. Thank you.
Let me pass it over to Mary for the hospital perspective. Mary?
Thanks, John. Good afternoon. My name is Mary Adam. I'm the director of the Pioneer Health Network. I am representing the Southwest region of Kansas today, the 18 counties in the Southwest Healthcare Coalition. Just a few things from our hospitals. The numbers do definitely look better than we had even hoped after the holidays. Hopefully that trend will continue. I think it's of note in the numbers that John went over on the dashboard that our number of COVID patients that are in the hospital is down from 55 to 37. But our acuity level, I think, is going up of these patients that are in the hospital because our percentage of ICU patients that are COVID patients is up to 50% from 41%. Part of that might be due to the increased availability of the monoclonal antibodies out there. Those are the medications that are getting out to our rural areas that they can give to patients who are not hospitalized, and hopefully will keep them from having to be hospitalized. So we'll keep an eye on that, and hopefully our ICU beds will remain stable, and we will have those available. Our long-term care units, the ones that have had surges and outbreaks, the ones that have cleared, they are still clear, but we have had one new outbreak in one of our counties in Southwest Kansas, and so they're dealing with that. And then another county, their long-term care unit was one that had an outbreak, and they're COVID-free right now, but they're back to testing twice a week because their numbers are up in their county. So I think that just shows the due diligence of our hospitals in trying to keep their facilities free of COVID as best as they can, and identify things quickly as soon as they can. As Jeanette said, vaccinations is forefront right now. We'll hopefully be moving to phase 2 soon and receiving those vaccines. I think in most of our communities, our hospitals are working with our county health to roll out that plan and make it work the best in each county. So I think I will go ahead and turn this over to my boots on the ground presenters. I am pleased to have two very busy ladies, both nurses from Southwest Medical Center with us today. Raquel Bryant is the director of ICU, and Carmen Sumner is the infection preventionist at Southwest Medical Center. This is in Liberal. It's one of the 3 larger facilities in Southwest Kansas. So Carmen and Raquel, I will turn it over to you.
All right, thank you for having us. So we just wanted to kind of update you guys on what's been going on and kind of what our plans have been. At this time, our COVID census is down compared to what it has been in the past. We have 10 patients on the medical floor and 3 in our ICU. 2 of them are on ventilators at this time. We have seen a decline in the numbers, and we're so thankful, but we're still just staying prepared just in case we do have another surge. So one of the things that we did to prepare for this was we turned one of our medical surgical units into a COVID unit that consisted of 18 beds. Our regular non-COVID rooms, it went down from 12 to 14, depending on what we had on our OB floor. Those 2 floors are on the same floor. In ICU, we've gone back and forth a little bit to accommodate for the COVID patients, depending on what those needs are. At one point, we did have all of our 8 rooms were COVID patient rooms. Right now, we have 4 and 4. So we've done 6 COVID patients rooms and then 2 non-COVID. We've just kind of tried to accommodate the best we can to care for as many patients as we can. And our ICU has remained consistently full. This is the first week that we've had open beds. We've also received a lot of transfers from different areas. We're used to receiving transfers from our local communities, Diamond area, Beaver area, but now we're seeing people from even farther out trying to transfer their patients here. And at times we haven't been able to accommodate that just because of we just didn't have the beds. Do you want to talk about our skilled nursing?
One of the other changes that we've made in this process is that midsummer we made the decision to close our skilled nursing unit that is attached to our facility down. Several reasons to do that. One of the reasons is that we would have had to test 70 staff members 1 to 2 times a week for COVID. And at that time, there's no outside funding to assist with the cost for that. So it really wasn't cost effective for us to be able to do that. And then also, as far as the pipeline for supplies for the actual testing wasn't terribly reliable at that time. So we wouldn't have even had the supplies to do the testing if we would have been able to make that work financially. The other thing is, staffing wise, we needed those employees that were working in the skilled nursing facility to go assist in our COVID and our non-COVID units. So that being said, we have turned our skilled nursing unit with a provisional license into an area where we've been doing some other things. We've used it for overflow for patients from our non-COVID units. We've used it as a discharge lounge. If you have questions about what that is, please feel free to call me. We're also currently now using it for outpatient infusions for that bamlanivimab for those infusions to help prevent those COVID admissions. So our staff's been really creative in using that space, even though we're not using it for those skilled nursing patients. So any patient that is dismissed or discharged from us that needs those skilled nursing facilities, we're trying to get them back to their home communities or as close as possible for skilled nursing admission.
And those communities have been working really well with us, so we're really, really thankful for that. Just back to the staffing real quick. I think that continues to be a challenge probably everywhere. It's not just with us. We've struggled to find some agency nurses willing to take assignments in this area just because a lot of the hot spots are paying outrageous amounts for those agency nurses. We've also lost a few of our staff to go do some of those travel assignments. But I feel really, really good about the care that we're providing. The staff that we do have, they've all just picked up extra, and we're just, like I said, being creative to try to make sure that our patients have the care that they need. We have an excellent hospitalist and PA program. They've developed protocols for our COVID patients. And we have medications that a lot of other facilities don't have that are included in that protocol. And I really feel that our good outcomes are because of those protocols. And our pharmacist has been incredible in getting us those medications, as well as administration allowing us to obtain them.
And just for some numbers, because that's what I do in my office, since March, we've had, and up through today, we've had 663 COVID positive patients as inpatients. 48 of those patients have been on the ventilator, and our lab, who literally are working day and night on this, have processed over 5,000 COVID tests. We do testing for outside physicians and outside facilities, as well as our own inpatients. And just kind of a fun fact, I've only seen 2 influenza patients in the last several months, since flu season started. So there's another reason that the mask works, if you want to spread the word on that.
And for our employees, when they do get tested for COVID, they also get tested for the flu, strep. So we are testing some for the flu. Some of the issues that we've had are with our COVID patients, we've had to go to no visitors. So that's been rough on the staff, on the family, on the patients at times. So we're trying to be creative and use Zoom or FaceTime for those patients so they can communicate with those family members. Even the ones that can't communicate, if they're on a ventilator, we'll try to do those Zoom calls with those families so they can see them and see that they are doing okay. So that's been really helpful. And then transfers, once again, those have been some issues too. We are in the process of getting set up with Mission Control. So we're pretty excited about that because we do feel like that's going to help facilitate some of those transfers, take down some of that time that we're using. So we're really, really, really excited about that.
That's a great pivot because we have Mission Control with us here today. The man, one of the guys who helped found Cheyenne Mountain Software and the Mission Control
I
app.
also have some active on this. I don't know if you want me to share those now or later.
Go ahead.
So one of the big things, COVID has been stressful for everybody, our nursing staff, not just nursing, but our whole hospital, because we all work as a team. And throughout all of this, I feel like our community has been really, really supportive. We've had, at the beginning when we were worried about PPE shortages, we had businesses donate PPE to us. We had most of our churches get together and do like a big prayer group over our hospital. They all lined up in their cars, flashed their lights. They did a Facebook thing. It was really, really nice. We had thank yous written out in chalk out on the sidewalk for the nurses and the staff to see when they left work. We've gotten food sent by our local restaurants, local businesses. We've had gift baskets, a lot of thank you cards from the families. We've even had thank you cards from the families whose patients have passed away or whose loved ones have passed away. And those are really hard to read, but it's really nice to know that even in the cases where we didn't get the outcome that we wanted, we're still getting those thank yous and appreciated for those cares. So even though COVID has been really, really hard, I feel like our teamwork has gotten a lot better and our community has really, really shown us a lot of love. So we really appreciate that.
Wonderful. Thank you for sharing those bright spot
Thank
stories.
you, guys.
Yeah. Carmen, Raquel, really grateful for the work that you're doing and how you're serving your community. And I love that the community's pouring love back towards you guys. Let me pass it over to Dr. Watson. You can give us an idea of what's going on with transfers and how that's changed over the last couple of weeks since you were on here last.
Yeah, great. And thanks for the plug there. That was nice, and certainly look forward to working together. Host, John, I'm sorry.
Oh, sorry. Geez, my bad. There you go.
Thank you. So I think it is. I think everybody's starting to feel like there's a little bit of capacity in the system, and statewide at primary and secondary receivers, we are seeing that they're opening up some, not nearly as much red in these numbers as there has been in the past. Wichita much slower to recover than probably the KC area. The western half of the state certainly doing much better than the eastern half of the state at this point. I think Mary was spot on that if you look at what we're seeing in the COVID true patients, those patients that have COVID as a diagnosis on transport, you're going to see their acuity index is actually up here in the 14 range, which considerably higher than even the time critical diagnosis right now. It's still roughly 30% of the calls we get are COVID patients. We are probably 15 to 20% in helping find beds at this time. And volume has been pretty steady, as much about the non-COVID patients as the COVID patients right now. And I think that, interesting, I think the observation about influenza, very true. And the difference between the infectivity of COVID and the infectivity of influenza, it is so much more contagious than influenza is. Even mild, even very simple measures, we could cut way down on influenza. I mean, it's amazing what this will teach us about the way we deal with some of these seasons, and particularly how it affects people's out of work days and all of that. So great observation there, and certainly look forward to this trend continuing. We hope that next week will be a similar picture for sure.
Thank you, Dr. Watson. If you can pass the hosting duties over to Paul here. We have Paul Harrison from, he's the Deputy Director at KDHE, talk a little bit about the testing strategy in the state and how that's been changing. Paul?
Hello, I think I'm unmuted this time, so you should be able to hear me. Hey, yeah, it's a pleasure to be here. Yeah, thanks for the introduction. I'm Paul Harrison, Deputy Director at the Kansas Health and Environmental Laboratories. And I just wanted to take a minute today to talk about the state testing strategy and kind of what we've done so far and where we're going. These are the 4 topics I'm going to try and touch on. There's actually a lot to unpack here. I know we don't have enough time to do it all, so I'll try and hit the highlight points, as we go along. So the state has actually performed over 2 million tests now. And that's indicative that includes over 1 million Kansans have been tested. So we've come a long way, but we want to continue to stress to people is that testing is not losing its importance. I know I've heard from a few people who asked me as this vaccine rolls out, does testing become less important? And I don't believe so, and I hope I can convince you of that too. So of course, what we need to do is continue to test so we can identify cases for populations that are not vaccinated, but also those who are at risk. So anyone with a comorbidity or who is just older in general, we know those people are more at risk, and we need to make sure that we can test people, identify where outbreaks are, so we know, so we can treat them and address this pandemic as we continue to move forward. And of course, we're always trying to work to get kids back in school and people back in work, and testing has to be part of that strategy. We have to be able to test people with some kind of frequency so that we know, we have confidence that, when we go into these kinds of settings, that we're not bringing, the virus into those congregate settings, if you will. So this is a map of testing sites across the state of Kansas. We feel like we have pretty good coverage. Of course, there's more people in the eastern half of the state. That's why we see more testing sites. And one of the challenges, of course, is trying to get testing in the more rural parts of the state that kind of meets that need. So what you see here is that the green dots are kind of what we call mass testing sites. They're actually collection sites. And that's kind of operated by Well Health and what's called the Go Get Tested platform, as I'm sure a lot of you have heard about. If you go to gogettested.com/Kansas, you'll see this map on the right-hand side here, where you can then book an appointment or just go to that address and show up and you can get tested as well. One of the things we've really been trying to do over the last month or two is focus on these red and yellow dots. So yellow dots are the public health departments that we know are testing, and the red dots are what we're calling community testing partners. And I'll get into this more a little bit on the next slide, but those could be anything from pharmacies to health departments to FQHCs to a state hospital. Anyone who says, we would like to be part of this, if you can just give us a little bit of help and guidance and maybe some supplies, then we'll go out and we'll test the public. We'll help test the public, and help control this thing. So that's what we're really trying to look to do as we move forward, is really just expand that community testing partner program. If you know anyone in your region or your community, that would have the capability and the desire to do this, please help, direct them towards us. I'll give out contact information here towards the end of the slide, but we are really looking to expand that program. And essentially the way it works is, we'll give you supplies and everything you need to do the testing. You'll be partnered with a lab that's been assigned for that region of the state to do that testing. And then you'll even get paid a collection fee to actually grab that specimen for us. We have partnered with 9 different laboratories, contracted laboratories, and then we also have the state lab, KHEL. So we got lots of capacity. We just got to get these specimens in, to run them. So we're going to do that. We're going to continue engaging with local health departments and also faith-based organizations. We've the United Methodist Church has reached out to us. They have lots of facilities across the state that they want to help us engage with this. We have mobile testing now here at the lab that we'll be sending out so that we can be more agile and kind of, pinpoint where we're going and help with outbreaks when we know that, where they're located at. And we've been using this mail-in saliva kits from one of our contracted labs. We'll put them in different locations, like a health department. Someone can come in, have that collection happen right there, and it just gets mailed back right to that lab. And the other thing we're going to do to help improve this experience is improve turnaround time. So that was an issue when we enrolled some of these labs to begin with. Especially we had a couple labs that were out of state. What we've done is we are directing all of those tests that were going out of state to Kansas labs. So we keep the business in Kansas, and we also get better turnaround times because they don't travel as far. And to be honest, our labs are good. The labs in Kansas, we have a lot of good labs, and they're really showing it. So we've been seeing 24-hour turnaround time, maybe 48-hour turnaround time. And it's been really great. So I'm just really proud of our state and our communities. So yeah, the goal here is to, like I said, keep up with that local engagement. We want to partner with anyone in your county or region. If you know of anyone in the community that could help us out, you just let us know, and we'll get that rolling. And then any feedback that you can give us to just help us improve, or maybe you think that we're not doing something quite right, you have a good idea, something's going to work in your community, we'd be glad to listen to you and work with you. That's really what we're here to do. And please encourage everyone to keep testing and vaccinate in your community. I know I'm running out of time, John, so
Yep.
here's the contact info. Yeah, this is the call center for KDHE. You always can reach out to your local health department. If you have an issue with the lab, you just email the KHEL helpline. And if it's one of the mass testing sites, the well health sites, yeah, this is the hotline to go to.
All right. Thank you, Paul. Appreciate you fitting so much in there. Just good to see this. We heard from Ellsworth County, the luck they're having with those mail-in kits, and just trying to make it more accessible as we continue down the road of fighting this virus and racing to get the vaccine out into our arms and making sure we don't have another spike in the meantime. So,
Can I make one comment real quick?
yes, sir.
Also, as everyone knows, as far as the new variant goes, the state lab here does have whole genome sequencing capability, and we are looking for it. We haven't spotted it yet, but everything else kind of tells us that it is here. But we continue to test for that. If you have anything that you think is suspicious or you think it might be a good candidate, get in contact with us and we'll run that. We'll sequence that specimen.
Thank you, Paul. We appreciate it. Paul, thank you, Mary, Jeanette, Dr. Watson, Raquel, and Carmen. Thank you for all the work that you're doing and sharing those bright spots. Love hearing that out of Liberal and everything going on there. So a lot of heroes out there. Glad to have a few of them on this call. And we'll be here the same time next week, 4:00, hear what's going on in the southwest part of Kansas. And hopefully we'll have a little more information on vaccine too. So thank you.